Dr. Carter will introduce in a second. You already met Dr. Moret. What an exciting time. Has anyone ever done aesthetics in this room? Maybe we started in, it's hard to even remember back that far, 2005, 2006, when nurses started getting interested in doing this industry because it's exploding. And there aren't enough providers to service all the people who want aesthetic services. It's an amazing time. When I first started, just my 30th year in practice, I know I don't look that old, but the only thing I could offer patients is surgery or no surgery. That's all I could offer. We didn't have neurotoxins, we didn't have fillers, but also when people came to us, they were old and they tried to look young, which is really hard to do. So it's kind of an interesting time. But it's a great time to be in this setting because it's changed dramatically. As I said earlier, when I first started, doctors were the only ones doing this, and they really resisted having nurses trained to do this. In fact, when I started out, one of my colleagues, in fact, more than one of my colleagues, came last about 4 hours, or 6 hours. He does a review of all the things that Russo says are important and answers any questions, goes over all the basics, and then you do this.
And the injectors say, I wish I knew the anatomy so I could be a better injector. So in other words, it's better to take it twice, right?
See what you've been doing, sometimes it's scary. See how close you've come to disaster. And part of the cadaver course, we actually let people inject some filler into the heads, so it's dyed. So you injected them, then you can cut them open and see where the dye landed. And sometimes it isn't in a great spot, and it scares you straight. So I learned that because when I went to my first cadaver course a number of years ago, it completely changed the way I injected. And then this is after doing it for 20 years. And I was like, wow. And then it also changed the way I taught it because I was like, how do we keep people from injecting into the superior and inferior labial arteries? How do we keep people away from the facial artery? How do we get people in the masseter in the right way and avoid some of the other muscles in the area? So it really helped me because most of the time you learn anatomy in 2 dimensions, right? You learn that.
That is to give you a really concrete understanding of the major concepts, anatomy around the neurotoxins treatment, but also around Dr. Russo's safe injection techniques.
It's not what you think you should see. It's not what Dr. Carter sees. It's not what you think Dr. Carter wants you to see. It's what you actually see. And your arms are different lengths, your fingers, your hand, your feet, different sides. Everything from one side of the body is different. And that's the hard part. That's the hard part. So it's really retraining your brain to accept what your eye is seeing, but also your eye has to see because your brain has to stop you from sort of saying, no, you really don't see 2 different eyebrows. They're really the same. That's what we kind of want. Skin, sun damage, broken capillary. Tell us what you see about her skin pore size.
The texture is really great. The pores are they're not deep or anything. They're really smoothed out. I don't know if you got a facial or something.
No.
It's really subtle, in the forehead, really subtle. And maybe the crow's. And is that just would you say that's just a mini dimple right by the mouth right there? What do they call
We'll get to that.
Okay.
You treat her way differently now after just 10 minutes of doing this than you would if she said, I want you to fill this. Because you're not a mechanic, you're an artist.
I went to aesthetic school back in 2005, graduated, I went to be an esthetician. Dr. Russo came and spoke at our school. I was totally inspired and decided that I wanted to do that. So I did that for about 15 years. Met some great people along the way. Just wanted to become a nurse and thought, okay, I'm gonna do this, right? About 7 years ago, went to nursing school just so that I could do this and somehow get close to Dr. Russo. Here I am, sitting next to him. Wow. So then about 4 years ago, went to Dr. Russo's school in Waltham and started taking all my classes. Took all my classes, became an instructor, opened my med spa in Reading, and here we are. So,
Right, good story. Good story, right?
Yeah, so now we're gonna do some neurotoxin on Denise. it anyways, we're gonna have a ptosis, right? So it's just better to not, treat anything we can't see today. So I don't want to treat for anything potentially down the line. I want to treat what I can see and then have her come back for a dose adjustment in the future if she needs it. So that's just better to do it that way. So raise again. You can see that all of her movement is here. She doesn't really have much function in the middle.
Tell me what you see with my face, what signs you do. We're not gonna talk about treatments, we're just gonna talk about what you see.
Okay.
Go.
I see some wrinkles under her eyes the most, I believe, and like on the side.
Let's go back a little bit.
Okay.
Tell me about color, pigment, texture.
So I see the obviously the
Vascularity.
hyperpigmentation on the
Yes.
sides more so. A little bit on the cheeks as
What do
well.
you see on the cheeks?
A little bit hyperpigmentation. She raised like this one went up much faster than the left one, and the
So,
left one kind of creeped up.
Are you saying that her right frontalis muscle is stronger than her left? That's the reason why the brows happen.
Yes.
Does everyone agree with you? You want to see it again? Raise your eyebrows. I'm not looking at it, so I don't know, but I'm asking you guys. Raise your eyebrows. Are you guys seeing it?
Yeah.
Is she right? 'Cause I haven't looked at it. Is that right? Oh. With neurotoxin, you can still make those go away. But once your neurotoxin wears off, she's gonna still have the line.
Always going to be people to do, no matter how many nurses there are out there doing it. We really believe in supporting each other, guiding each other. You have a team of people to help you answer questions and to kind of guide you, and we're all available to you. So once you have finished the courses, you take your sign-off, which is kind of that driver's test, where we make sure that, really there's an instructor in the room, and we're really making sure that of what you have learned is